Hello everyone, my name is Vivian Cheng and I'm a Master's of Public Health and Physician Assistant student from Arcadia University. Today I will be presenting my poster titled Diabetes Self-Management Behaviors Among Asian Americans. According to the American Diabetes Association, diabetes is a complex chronic disease that affects the body's ability to convert food into energy. It requires continuous medical care and risk reduction strategies. Poorly controlled or untreated diabetes leads to long-term complications such as leg amputation, kidney damage, and stroke. As of 2017, diabetes has been the fifth leading cause of death and prevalent in about 21% of the Asian American population. Asian Americans are twice as likely to develop type 2 diabetes than non-Hispanic whites. A contributing factor to this could be delayed screening and diagnosis. The recommended BMI cut point at greater than or equal to 25 kilograms per meter squared misses about 36% of Asian Americans affected by type 2 diabetes. Thus, they have a higher chance for delays in care. Differences in diabetes self-management behaviors have been linked to socioeconomic status, disease awareness and knowledge, and access to healthcare. Previous studies have focused on self-management behaviors among non-Hispanic Blacks, whites, and Hispanics, but Asian Americans have not been the focus of much recent research. Therefore, the purpose of this study was to assess the differences in self-management behaviors between Asian Americans and other racial and ethnic groups. We conducted a secondary data analysis from the 2017 Behavioral Risk Factor Surveillance System, or BRIFIS. The independent variable race and ethnicity was self-reported and categorized into the following: non-Hispanic white, non-Hispanic black, non-Hispanic Asian, non-Hispanic American Indian/Native Alaskan, Hispanic, and non-Hispanic other races. The three dependent outcomes of interest were diabetes education, self-feed checks, and self-blood sugar monitoring. Diabetes education was assessed by asking participants whether they have taken a course or class in managing diabetes, and these were coded as yes or no. Feet checks was assessed by how often participants checked their feet for sores or irritations, and blood sugar was measured by how often participants checked glucose. All of these variables were coded as either doesn't check daily or checks daily. Additionally, the following covariates were included in the analysis: age, diabetes onset age, BMI, education, sex, marital status, insurance, income, insulin, and routine checks within the past year. All covariates were transformed into categorical variables. A statistical package for the social sciences, or SPSS, was utilized to analyze survey results. To illustrate patterns of racial and ethnic disparities, we used a chi-square test to assess bivariate relationships for the several racial and ethnic groups. Then we ran three separate multiple logistic regressions for each dependent outcome, adjusting for covariates, and reported adjusted odds ratios and 95% confidence intervals for each outcome. We applied survey weights to account for the complexity of the BRIFIS survey design. Results show that non-Hispanic Asians have lower proportions of persons who have taken a course on managing diabetes, self-check feet daily, and self-monitor blood sugar than other racial/ethnic groups. In the fully adjusted model, we saw that non-Hispanic Asians were significantly less likely to self-check their feet daily for sores and irritations compared to non-Hispanic whites. This significant association was consistent with prior research. In a 12-year trend study, researchers found that compared to non-Hispanic whites, Asians were 60% less likely to self-check feet daily, and the rate decreased even further to 30% when combined with daily blood sugar checks. While we found that non-Hispanic Asians were less likely to have taken a diabetes class and checked their blood sugar than other racial/ethnic groups in our bivariate analysis, this relationship did not remain significant in our fully adjusted models. This may be attributed to the low sample of Asians in the analysis. Out of the 46,235 diabetic adults, only 586 were identified as non-Hispanic Asian. Another reason is BRIFIS excludes participants who do not speak English or Spanish, leaving this group underrepresented in the analysis. Overall, race and ethnicity may be an important indicator of self-management behaviors, which are critical factors in treatment and health outcomes. Asian Americans seem to be less likely to engage in these behaviors than other racial/ethnic groups, particularly self-feed checks. These findings may contribute to a better understanding on how self-management behaviors differ between Asian Americans and other racial/ethnic groups. However, further research on the influence of self-management behaviors is needed to make inferences about the difference between Asian Americans and other racial/ethnic groups.